Well, thanks very much for logging in and clicking on the link to come to YouTube. I'm hopeful that I'm going to take the next several minutes and tell you a little bit about our strategic plan and how that relates to physician recruitment and clinics and how we provide care here in Newton and Jasper County. So let me first start off with some statistics for you. There was a study that was done recently and it looked at the population to primary care physician ratios for 3 counties. That was Mahaska County, which is where Oskaloosa is, Marion County, Pella is there, and then Jasper County. What they found in this study is that in Mahaska County there's about 980 people per primary care physician. In Marion County there's about 1,130 people per primary care physician. And in Jasper County there's 1,823. Now you know that tells us that we don't have enough physicians practicing in our county. We know this anecdotally and through our own data because we have seen our market share decline by about 10% over the last 5 years. We've seen our volumes decline about 10%. I'm very happy to say they've stopped, and in some cases they've started to turn around. But we know that we have a number of fewer providers practicing here in our county. Dr. Martin's office closed, as we all know, for obvious reasons. Dr. Jessen retired. The Newton Clinic is a wonderful, wonderful clinic. They have great doctors. In fact, my own doctor is one of their doctors. But you know that they cannot fill that gap. And they're a great clinic, they're very busy. So we know that we don't have enough physicians in our county. In fact, we've done our own analysis and we found that there's a particular need in the area of internal medicine. Imagine this, we have one extraordinary internal medicine physician in Jasper County. In Grinnell they have 4 in the city. In Pella they have 4 in the city. Our analysis indicates that we ought to have at least 5 or 6, and we have 1. You might be surprised to know that every month we send 40 to 50 patients to be admitted to hospitals in Des Moines from our ER. Depending on the month, the number of patients that we send for internal medicine and cardiology reasons are between 25 and 50% of that. So we have patients that really ought to be hospitalized here and cared for right here that we just cannot keep. The families have to drive to Des Moines. So let me tell you the story. Several months ago, I met a gentleman named Todd Birch. Now Todd used to be a hospital administrator, actually out in western Kansas, although he's from Oklahoma. He ran several hospitals in western Kansas, very entrepreneurial kind of guy, and he had a couple of companies that he had as well. His information systems department was run by a company called ICE Technology, which is actually located in Pella, not far from here. The folks at ICE Technology and Todd got to know each other pretty well, and they decided they wanted to create a business together. They called it Red Rock Health Ventures. And they've been doing consulting and other works with hospitals and clinics and other healthcare organizations for the last couple of years. About 6 months ago, they decided they really wanted to get into the business of investing in healthcare with venture capital. So they got some backers, and they decided they're moving into this, and that's their business model. They invest in healthcare around the Midwest. Now, I actually got to know Todd outside of work, and he and I have had many conversations about the fact that we just didn't have enough physicians practicing in our county. And he said, you know, you're really right. He said, although I don't live in Pella, he said, I work in Pella. And he said, I hear lots of things about what Pella Hospital is considering doing. And we knew, of course, that they were looking at opening an occupational medicine clinic right here in town, and in fact, they have done that now. The fact is that Pella sees exactly the same data that we do, and they see that there is a gap. They see there's a need for physicians. And we don't know what their plans are, but you know, they're very bright people in a very good hospital, and it wouldn't surprise me if they wanted to try to fill that gap with their own physicians. So, as Todd and I were talking, he said, you know, I'd like to run my own analysis. So he did. He did an analysis, and what he found is that there are 28,000 visits, physician office visits, leaving our county every year. That matched up pretty well with the analysis that we had done, although 28,000 is a big number. And he said, you know what? He said, we're in the business of investing in healthcare in communities. And he said, we would like to come to your community and open a multi-specialty group practice with internal medicine, neurology, actually taking on the neurology search that we have. He said, we'd like to start with that. We don't want to do family practice in Newton because you have a wonderful clinic, the Newton Clinic, that provides family practice right there for you and obstetrics as well. He said, we want to be a multi-specialty group practice, internal medicine, neurology, other specialties down the road. Not specialties that we provide in the Skiff Specialty Clinic with the folks that visit from Des Moines. We have wonderful visiting specialists like our oncologists that come from Des Moines and provide care here. So we thought this was wonderful because it's a way to bring more physicians that will practice at our hospital, that will live in our community, and by the way, they're insisting that they live here. We'll bring support staff and nurses that will be practicing here. And I'll tell you what, they've actually already bought a building. And the fact is that they could come to town whether we wanted it or not, because it's a free country. If Pella came to town, anybody could come to town. So they bought a building. It's actually located just about 4 blocks away from the hospital, one of the buildings of the old Maytag headquarters complex. So we're very happy that part of that structure and part of that campus is being used now, especially for healthcare. So that's a very good thing for us. So we'll have internal medicine physicians that will be practicing here and admitting patients and providing consults and providing care for people in our community that frankly have left to go to Des Moines. We're very hopeful that that's going to bring those people back from Des Moines. Now here's another thing. They kind of threw us for a loop because Todd asked me about whether we would be interested in having them acquire our rural clinics in Baxter, Colfax, and Monroe. Well, you might know those clinics have been there for a while. We actually acquired them over the course of many years from physicians and folks that practice with the Newton Clinic. And we know that we don't do a great job of running those clinics. The fact is that the clinics on their own operations really don't have a history of having a positive margin. In fact, a couple of years ago there was talk that they would be closed because of that. Now we committed to keeping them open for a couple of reasons. Number one, they're needed in those communities. In Colfax and Baxter, these are the only medical practices in those communities. And if you talk to the mayor out of Baxter, he'll tell you that small communities need 2 things to be able to survive. One is healthcare, the other one is schools. So it's important that they be there. We've made a commitment that they would be there. The other reason, frankly, is that those providers see patients, and those patients need things like x-rays and labs and surgery. So that's a source of patients coming into our main hospital. In fact, we've decided that it was probably worthwhile having those, even though we didn't run them real well, because we're a hospital, we don't practice very well in the clinic environment. So as we're talking to Todd, he says, you know, here's some things I can do. He said, we have expertise in running clinics. We have the ability to provide incentives to see more patients in those clinics. We have capital that we could put into those buildings. And if you've been to Monroe or you've been to Baxter, those buildings really need to be replaced. And they have the ability to rotate specialists out in those communities. Things that we just don't have the ability to do. So we've agreed. And in fact, those clinics are going to be acquired fairly soon. They will become the NewCare Clinic of Baxter and Colfax and Monroe, and the NewCare Specialty Clinic right here in Newton. They'll all be together as one organization. We're very excited about this because that's going to grow the number of patients that get care right here locally, the number of patients that come to our hospital for care. I think this is great, and it has a positive impact on the economy of Newton. We love that. You know, we're the 3rd largest employer in our county. And as we were doing our strategic planning process, one of the folks that's a leader in our community came to us and said, as that 3rd largest employer, and as the only healthcare organization that is very large in the county, we really need your help to revitalize the economies of our communities. We really took that to heart. This is one of the ways we do it. Let me read a couple of questions that folks have. What are the NewCare clinics? Well, although the folks that are running NewCare Clinic and running Red Rock Healthcare have a lot of experience in healthcare and clinics and hospitals and information technology, this company itself is kind of new. So NewCare Clinic is a company that will be just in Jasper County. It will be these 4 clinics, and they will be dedicated to working here with us. Are the rural clinics closing? No, the clinics are not closing. The signs will change. They will say NewCare Clinic of Baxter, Colfax, and Monroe. All of the people will be the same. In fact, they're going to be working for NewCare Clinic. It should be really pretty transparent to our patients. Is the Skiff Specialty Clinic closing? Well, no, of course not. The new multi-specialty group practice down the street will not duplicate services that our visiting specialists from Des Moines and other communities provide when they come to our hospital. Are the healthcare providers leaving the clinics? No. In fact, I think that they're going to have an even easier time and a better time of attracting patients to those clinics, and they'll be able to do an even better job in the future. Will NewCare be a competitor to the Newton Clinic? Well, you know, they've made a commitment that they will not hire family practice physicians to work in Newton because they don't want to compete. They want to be a complement to the Newton Clinic. Now, we all know that the patients make decisions, and we can't always judge where they're going to go, and there may be some transfer back and forth. But the primary goal of NewCare Clinic is to bring patients back from Des Moines, higher acuity patients, admitting patients for things that we just don't admit now. So that is not their goal. Is NewCare Clinic owned by Pella Regional Health Center? The answer is no. Although Red Rock Healthcare is located in Pella, they are not affiliated with the hospital in any way. They are an independent organization that will provide care to patients in our own community. Well, I hope that this helps to clear up some of the confusion, maybe some of the questions that are out there. I am very excited about these additional providers coming to our town, to our community, to our county. And I think it's going to have a great impact, not only on the hospital, but on our patients and on the economy. Because you know, every dollar that is spent locally on healthcare generates 7 other dollars downstream. So I hope that this has helped. If you do have any questions, I would ask you to feel free to call us here at the hospital. Hope you have a great day.